Good morning. Today is Saturday, December the 26th, 2020, and this is the English language summary for the daily press briefing here at the Center for COVID Situation Administration, or CCSA. First of all, I'd like to extend a warm welcome to the English daily press briefing. Again, you'll be seeing us during this time on a daily basis. Of course, happy Boxing Day as well. For the world situation and how COVID does not discriminate, I'd like to begin first, of course, that the CCSA continues to follow the situation worldwide. And if you look at the numbers, today it has reached 80 million infected persons worldwide already, with 17 countries surpassing 1 million, the 1 million mark of confirmed cases within their own countries. The CCSA therefore shares this information on global statistics every day so that we can see the bigger picture and be constantly aware of how COVID affects everyone, irrespective of nationality, gender, and age. And of course, as mentioned yesterday, COVID does not discriminate, and neither should we. The spokesperson mentioned about the global statistics every day, including the ranking of Thailand every day as well, and that is the purpose for us all to be aware of the global situation. On active case finding, of course, you've seen in the news yesterday about certain alleged cases within the government house compound here in this location where we are having the daily press briefing. So for that case, Chulalongkorn University Health Service Center conducted active case findings in, of course, in Bangkok and controlled Bangkok, which is a controlled zone. And for the government house here itself, randomly testing 350 civil servants here. Initially tested positive, raising concern among many circles, and it was also in the news yesterday. So we are relieved now to learn that the swab tests taken later on returned with a false positive. So therefore, there is no need for alarm. For the situation in Samut Sakhon, developments there, the governor there has ordered the testing method for COVID to be changed for quicker results, and emphasized that all at-risk groups, both Thais and migrants in the province will be tested. The current testing method of inserting a swab into the nose to extract a fluid sample will be replaced by taking a blood sample, which can produce results in a shorter time, in 30 minutes. The field hospital in the Central Shrimp Market of Samut Sakhon is now currently operating in 24 hours. And the governor has arranged for more beds to be sent to accommodate up to 100 plus patients. And you have a slide there. The patients with minor symptoms are sent to the field hospitals, while those with severe symptoms are sent to designated hospital. The province also plans to turn the Central Sports Stadium into a medical care center to accommodate up to 500 patients at a time. For assistance rendered to migrant workers, the health authorities fully understand the concerns of migrant workers and have issued guidelines on the new normal life for migrant workers to avoid COVID-19 in the Myanmar, Lao, and Khmer language. And you have on screen an infographic there. There's also in the three languages mentioned. Just to let you know, of course, that during this broadcast, many television channels and social media pages will also be beginning to provide Myanmar language captions and also sign language and simultaneous interpretation for the CCSA's daily press briefings. These include television channels such as Thai PBS, as well as pages like Myanmar Live News page on social media. So for our Myanmar brothers and sisters living in Thailand, you can avail of that direct communication in your language from these channels, Thai PBS and other social media outlets. Also, Dr. Thuisin, the spokesperson, mentioned about the restructuring of the administration, the command structure of the CCSA, wherein the various agencies under the CCSA would be adjusted. Yesterday, the Royal Gazette published information on this new structure, which is aimed at effectively addressing the new wave and new structure, new regulations. Also, for the Mochana application, as mentioned yesterday, that will be developed for expanded use. Of course, this will track the movement of users and focus on their travel history. It has been used in the past months, and we'll be upgrading it this time around because of the new surge. So moving on to the general situation, number of cases. We have a slide coming up for you. New confirmed cases today, we have 110, making the total number of cumulative cases in Thailand 6,020. Recoveries 4,115, and no additional fatalities from the original number. Observations, 64 of this number are local transmissions, 30 are from active case finding in Samut Sakhon province, 16 detected within the state quarantine system. Right now, the Samut Sakhon cluster has affected 33 provinces nationwide from that cluster. The majority of new cases from local transmissions and active case from Samut Sakhon, of course, that's the epicenter of the current new wave. So therefore, of course, imperative to keep your guard up during this time. Just briefly on seafood consumption, because that has been in the news and it affects trade and business and various markets in Thailand, in our markets abroad. So currently, no scientific evidence to suggest that COVID can infect aquatic animals, and the Public Health Ministry came out with this earlier. Therefore, these seafood animals cannot transfer COVID to humans. And experience from previous outbreaks show that there were no disease transmissions from food consumption. At present, no evidence to suggest that COVID would be any different. None of the COVID cases found worldwide came from food consumption as well. Therefore, safe to consume seafood as long as it is cooked and served in accordance with the recommended hygiene and food safety standards. It is advised that you consume clean food, and of course, in farms and everything, the cleaning of animals thoroughly and food thoroughly with protected hands, making sure that they are well cooked before eating. Meat, I'm referring to meat and poultry and other food. The recommended temperature is 56 degrees Celsius for 30 minutes or shorter if the temperature is higher. Nevertheless, the Fisheries Department, also working with other agencies to monitor the situation, the possible spread of COVID in the fisheries sector as well. And we'll have a slide coming up for you soon on that as well. The fishing crew, workers at all piers are screened, and preventive measures are in place during food processing. And in addition, inspection teams from the Health Ministry have visited a number of markets, seafood markets, to ensure sanitary standards. For migrant workers, number of workers infected yesterday is on a downward trend from previous days, which this reflects the effective measures so far. These past few days are very, very important in containing the outbreak. As for additional observations, just to remind that all international travel have to undergo mandatory quarantine. That has been a mainstay for the past months, and international visitors to Thailand who are still coming in various schemes may select, of course, a wide range of accommodation, either the ASQ, ALQ. These are accredited accommodations by the government, whereby the visitors would have to shoulder their costs there. Yes, and there is a slide coming there up there. There has been a a development in terms of more collaboration with various agencies in terms of managing the hotels, the ASQ, including with companies as you saw on screen just now. For example, collaboration with companies like Agoda or the Loka Nation and the Tourism Authority of Thailand and etc. Of course, this is strong collaboration between public and private sector. So just to ending notes, to end with some infographics which were produced by the Public Health Ministry in collaboration with other agencies to raise awareness. This has been translated in various different languages of our neighboring countries, such as on how to use the cloth mask, the mask, which is an important defense when going outside in public. You see that in English, and there's also in other languages as well. Of course, the virus is small in size, as demonstrated by Dr. Tuwisin, the spokesperson just now, and it is emitted through respiratory droplets from infected persons. And these masks, be they surgical or cloth, can prevent large droplets from entering the respiratory system. That's why that's been advocated. The N95 medical grade masks and the PPEs are only necessary for individuals who have been in close proximity with confirmed cases of COVID, and those that are involved in healthcare, like healthcare workers and medical officers. Just some ending slides. Social distancing to reduce the risk of COVID-19. How to protect yourself from COVID in the workplace, and these are available on social media, of course. How to self-quarantine at home, and information on that has been tailor-made actually for specific groups, such as mothers with suspected confirmed cases of COVID. Yes, you see that on screen now. In their breastfeeding with certain precautions. So this is all available in the online of the Public Health Ministry and other agencies, available in different languages. Our aim, of course, to promote inclusiveness and protect all communities. No one is safe until everyone is safe. So please continue to take care of yourself and your family. And this is all I have for today. Sawasdee krap. Happy Boxing Day and have a very pleasant weekend, and see you tomorrow. Sawasdee krap.
ครับขอบพระคุณนะครับท่าน